Good afternoon, everyone. Condoms aren't completely safe. A friend of mine was wearing one and got hit by a bus. Today I'm going to be discussing condoms and the positive effect they have on reproductive health. My name is Brittany Osborne. I've been an LVN for over 10 years. I also previously worked with at-risk addicts discussing safe sex practices for over 3 years. I developed a plan for the rehab that I worked at to educate those that may not have had as much information to help prevent the spread of STIs and unwanted pregnancies. The quote I said earlier was spoken by Robert Rubin, and I don't believe I've ever heard it used before, but it is a great topic starter to discuss condoms. This conversation regarding safe sex has been around for years. Sexual intercourse is something that most people engage in at some point in their lives. This demonstration is going to be an eye-opening experience into safe sex. Any healthcare provider will explain the benefits of using condoms as a method of avoiding an unwanted pregnancy or preventing STIs. STIs are a acronym for sexually transmitted infections. Any healthcare provider is going to discuss the benefits of condoms, but they're not always going to demonstrate the condom usage and how they should be used properly. In 2020, there were 374 million new STI infections globally among adults between the ages of 15 and 45. 1 in 4 of the STIs acquired were curable. These included such STIs as chlamydia, gonorrhea, and syphilis, according to the World Health Organization. With the amount of information available regarding condoms, we need to utilize this obvious tool to protect ourselves and others. If you have ever had a reproductive health scare, whether it was being concerned about a positive pregnancy test or having unprotected intercourse with somebody and worrying about an STI, then this information is going to be very valuable to you. I will demonstrate using a banana and a condom how to wear the condom properly. According to the World Health Organization, 99% of women that properly utilize condoms can prevent STIs and unwanted pregnancy. Condoms are currently the only available multi-purpose prevention for HIV, STIs, and unplanned pregnancies, according to the World Health Organization. Apologies. Condoms can be used in conjunction with lubricants. However, water-based lubricants are advised over oil-based lubricants, as the oil-based lubricants can weaken the latex in the condoms, leading to potential breakage. A study found that when oil-based lubricants were used, there was an increased breakage that occurred with the condoms. I will also educate you on ways to minimize improper condom usage. According to a study that's spanned all 50 states, between 15 and 51% of people admitted to putting condoms on partway through intercourse. This could lead to improper usage of the condom. It also negates the disease-controlling benefits of condoms, as well as the unwanted pregnancy factor, as sperm can be present in pre-cum fluid. Additionally, the study found that around 25% of people unrolled the condom prior to placing it on their penis. This, once again, can lead to improper usage, as well as not leaving enough space at the tip of the condom for the seminal fluid. Between a quarter to a half of the people surveyed admitted to not leaving space at the end of the condom. This is called the reservoir and can lead to breakage if there's no space for the seminal fluid to go. Also, the seminal fluid can travel outside of the condom and enter the vaginal canal that way. It's important for those that are utilizing condoms to realize that condoms do have an expiration date. Condoms should not be used beyond the expiration date, as the latex breaks down and breakage can occur. This breakage will lead to STIs, can lead to STIs, as well as unplanned pregnancies. Additionally, those using condoms should always check the condom for damage prior to the condom being used. This includes such damage as tears or holes. Using an incorrect size of condom can lead to breakage if the condom is too small, or the condom slipping off during intercourse if the condom is too large. Condoms are intended for single use and should not be reused. This can lead to increase in contamination or infection. Improper storage is also a main factor when it comes to condoms and their potential for misuse. Many people store condoms in wallets, and these wallets can lead to damage to the condoms. Additionally, when using condoms, teeth should never be used on the condom package, as this can potentially break condoms and lead to said tears, holes, things like that, that can impact the condom's usage. So at this time, I'm going to demonstrate using a bandana and a fresh condom, how condoms should be applied properly. Here we have our banana. This is our wonderful demonstration to simulate a penis. This is our fresh, unopened condom. We are going to take this condom and tear the corner gently. This is going to leave an opening for the condom to be pulled out. You want to ensure that the condom is placed correctly and also ensure that it is left with opening. Here you can see the tip of the condom, also called the reservoir. This is where the seminal fluid is going to be deposited during intercourse. You're going to want to squeeze the tip of the condom when placing it on. This prevents any air from being trapped inside there. If there's air trapped inside there, again, this can lead to breakage or the seminal fluid having nowhere to go, so it will travel down the penis and can enter the vaginal canal that way. Additionally, you can see here that the condom is rolled. This is to make for easy application. You don't want to pre-unroll the condom, as this can lead to improper usage. Additionally, the condom is also pre-lubricated. This allows for easy slippage and prevents friction, or to decrease the potential for breakage. So here we have our penis demonstration, our condom. You're going to pinch the tip gently of the condom and place it over the tip of what would be the penis. Here you're going to gently roll down the condom, ensuring that there's ample space at the reservoir tip. Here you can see the reservoir tip has plenty of space for the seminal fluid. You're going to unroll the condom down the penis until you reach the base of the penis. At this point, the condom is now safe to use. When removing, you're going to be very cautious. You're going to remove your penis from the vagina, and then you're going to unroll slightly, and then you can begin to pull off from the penis. It's a little easier in actual application. The point is to keep the seminal fluid within the condom space. So as you're going, you can remove it, ensuring to keep the seminal fluid within the condom. Again, it will be a little easier in actual application. And there you have proper usage of a condom. With that being said, in conclusion, condoms play an important role in reproductive health. Condoms can prevent 98% of infections and unwanted STIs when used properly with proper precautions taken. Unwanted pregnancies and STIs are a leading factor for reproductive health for both men and women. As healthcare providers, we need to ensure that we encourage the proper use of condoms to maintain the health of our patients and safety of all. Thank you so much.